Hey everyone, it's Antoinette, your visionary nurse, and welcome back to the Visionary Nurse Podcast. Stay tuned. So hey everyone, it's Antoinette, your host of the Visionary Nurse Podcast, where the purpose of this podcast is to accompany the work I do as a community health consultant and coach and mentor for nurses and beyond. And it's just designed to educate, uplift, and support each other as we dare to be influentially visionary. It's been so exciting to be able to have the podcast back up again. We've got some great guests lined up for this series and season, just really focusing on community engagement. And as we know, there are so many shifts in healthcare right now, and many are looking to innovatively expand their knowledge in a variety of settings. It's more important than ever to create sustainable and collaborative changes that cross sectors to influence access to care, business growth, and the operation of organizations and institutions. And it's most important so that we can continue to navigate the many changes in our society. So I'm so excited for this upcoming episode that we have with a wonderful, wonderful individual that is doing such passionate work in our community. Introducing to you founder and executive director of RIZE Prevention. They have so much movement, so much amazing passion that's happening working with youth, and just really looking at how can you empower youth to prevent drug abuse, use, and being able to live a happy and healthy life. So I'm excited to have Martine Helou-Allen with me today on today's episode of the Visionary Nurse Podcast. Martine, how are you doing today?
I am doing fantastic and just very, very excited to be on with you and just grateful for the chance to, benefit from your wonderful platform and all the work that you've done on the Visionary Nurse podcast to get out our message.
I'm excited for it. And I know I probably didn't do full justice to your organization and to you. So I want to make sure that people get a chance to hear it from you firsthand. Obviously, I could probably gush on and just excited to see what you're doing, what you've been doing, how you are engaging the community and youth. But just so they can hear it straight from your mouth, just, tell us a little bit about yourself, your current role, and why you're passionate about it.
Sure. Well, my name is Martine. I am the founder and executive director of RIZE Prevention, as you mentioned. And I have a passion for teens. I have a passion for teens and preserving them because they are the future of our communities. I also have a passion about being very much against drugs and against the chaos they cause, the sorrow, the loss. And I feel like we really need to fight against this to on behalf of our teens who are actively being targeted to become the most addicted generation our world has ever known. And so I just decided to stop talking about it and do something about it. And I established RIZE Prevention.
I love it. I love it. I love it when you can take passion into action, right? That's such a huge piece of being a visionary. It's such a huge piece of really, truly engaging the community. It's when you can get to that point of that, I'm not just going to think, like you said, I'm going to put it into action. And I'm sure, there were many steps to it. And I hope we can unpack some of the pieces that led you from the idea piece to the action piece, but maybe just to give a full background as much as you can within, the window of time that we have, if you could tell a little bit more about what your organization does, what RIZE Prevention stands for all the way around, and how does that engage youth, especially around this topic of drug addiction and abuse, and like you said, the chaos that surrounds it, and really being able to, which I'm sure you'll go into, help them rise above.
Sure. Yeah, you got that right. Rise above. So basically, we, as an organization, we were established to do one thing, and that is to provide effective drug prevention programming to teens that delays the onset of their use of drugs, hopefully for the rest of their lives, but at least delays it through those critical adolescent years when their brain is, developing rapidly and responds to anything that is put into the body, and even experiences that they have. So really working with teens to do everything that we can to delay the onset of experimentation with drug use. We also are very, very dedicated to being evidence informed, evidence based. We look at techniques that have worked, strategies that have worked before, but we also look at how can things be done better. So prevention science is relatively new. And I think that a lot of people don't know that. So it takes a lot of time and effort to make a really great prevention program
Hmm.
and to prove that it's effective. So you can have evidence based programs all day, i.e., they are based on what has been evidenced to work in silos, right? But it takes time to actually put all of those evidence based solutions into an overall programmatic approach. So that's what we're trying to do. We are trying to put all those pieces together to make a program for teens that is school based, that is proven effective in the realm of drug prevention.
I love it. It's so beautiful. And obviously, you've probably had to put a lot of heart and soul into getting that into play. And I think that's such an important factor that you put that it takes time, right? It takes time, it takes energy to find the right model, to find the right program. And sometimes it's not that cookie cutter. Sometimes it doesn't just, you have the idea and it just flows right off, right? You have to really
Right.
figure out, test and try it out, and then make sure it fits not just within that little incubator, but actually in the population at large. And I think that's such an important piece when we think about community health, when we think about community engagement, when we think about innovation, right? Because innovation's the big buzzword now, where it's really trying to transform health and transform the way we understand how health is delivered, not only within maybe traditional clinic settings, but in the community, being able to reach the very people that need the resource and making sure the model fits them. So I love that you take that kind of concept of here it is in this incubator, here it is in this silo. How can we make sure that it fits those who actually need to receive it, our precious teens and our precious youth, and just being able to transform what the outlook of their life looks like. So I
Right.
love that. I love the mission behind that. I love the vision behind that. And I'm sure, again, you being passionate about it, it comes natural to you to talk about it in a way it flows with passion. You can hear it in your voice and how you explain it. But I'm sure there's been some challenges, right?
Oh my goodness.
I'm sure there's been challenges to the process. And, this is the nitty-gritty of community engagement. But if you're willing, I'd love to hear what are some of those big challenges that you faced, maybe in your role
Mhm.
specifically, maybe within the community, or even just the essence of your organization and where it's at right now.
Sure. The biggest challenges that we face are number one, trying to say that we're different from the programs that haven't worked in the past,
Yeah.
meaning we're very different from DARE. We're very different from Just Say No. In all these programs, we are not a curriculum. So we're trying to get over this skepticism about the fact that we're not a curriculum, trying to change the way that people think about drug prevention. And also, there's a lot of people that are jaded about the drug prevention programs that were sold to them as being the wonderful solution to this problem. And they really made the problem worse.
Mm,
So trying to get over that skepticism with people to give us a chance. So we are very, very blessed that we were able to have some schools and communities that gave us the chance, and they're seeing the difference in our program and in
right.
our approach. Another challenge would be innovation itself. People don't like change. It's not natural to them, so it's not something they're going to go, oh wow, you're going to change the approach, we're ready, come in here and test it on us.
Right. Right.
So that's been a challenge. I think too, because prevention science is very new, as a field, the knowledge that's out there and really sifting through what has been proven and what hasn't been proven is a challenge in itself, because there are so many different opinions out there, on
Right.
how to do the right approach. So sifting through all of that and then trying to pull all of the things that are really good, pulling that all together within the context of providing a program within the school walls
Right.
with the limitations of the time that these kids have to spend on non-academic programs, but within the school hours. That has been challenging. Also challenging was to do a school-based program that is effective, delivers knowledge, but then also finding a way to make our program comprehensive in that we also integrate families and we pull in the community, because we know that the community has to be involved.
Right.
So it
Right.
was like, how the heck do you do all of that? So that was the greatest challenge, is to make a program that is, if you would, all inclusive, and then trying to have enough time to get people to trust us to test this, because a drug prevention program is not proven effective in less than 10, sometimes 20 years.
Wow.
Okay. And
Wow.
you got to be able to gather data to prove your efficacy. Well, then you've got another challenge, which is school districts don't like to share data, especially when it comes to drug use.
Right.
So, how do you know if you're having an effect?
Right.
So those are some of the greatest challenges. And of course, funding for nonprofits with innovative ideas, that's always a challenge. So, but thankfully, the Lord has been with us. He's sustained us and has given us the opportunities to prove to those who have brought our program in that we are really are a wonderful addition to what they offer at schools.
Yeah, no, that's so good. And I mean, obviously I applaud you to push past the threshold, right? Push past the barrier of it, because with any front runner or pioneer, I mean, that's the essence of innovation, right? Changing something, sometimes creating something brand new, but then sometimes it's taking a look at what has been in place and giving it a new spin, a new model, a new understanding, that what maybe wasn't effective before can be effective in this light, in this way. It's why we have, 1,000 different t-shirt brands. They're all still t-shirts, but they all have their individual uniqueness about it. And this is obviously much more than just a t-shirt brand. This is an entire life experience. And that big piece that you mentioned about trust in the community is the essence of all of it, right? How do you take the
Yes.
model that you know is effective, instill the trust, go from a reactive to a proactive stance, and then being able to apply that in a way that just really creates the biggest impact? And sometimes you can't measure change in the community as easily as you can in maybe a hospital setting, maybe acute care, maybe in a clinic where there's things that are tracked in different ways. You may
Right.
not see that change until years from now, right?
Oh, absolutely.
That teen may get that program. Exactly. They get that program. They're in school. It might impact them, but you may not be able to catch that data until, who knows, like you said, 10, 20 years down the road, based off of life decisions that were made or skill sets that were chosen. And I think that's such an interesting concept of thinking about, sometimes schools don't necessarily want data about drug use to be revealed, because then who wants to have to say we have this issue in our school.
Well, yeah. And another thing is, like even locally, I'll tell you, the recently came out of the news that a local middle school teacher has been arrested for basically selling contraband to middle school
Oh,
students. And
wow.
that's recent. That hasn't even come out in the news yet.
Wow.
So the schools have a lot of power regarding what information gets out from the
Hmm.
school. Because you know what? Here's the thing, too, is that it's not because they're bad, it's because everybody thinks that the school should fix all the problems.
Yeah.
And that's not fair. It's not fair to put all that pressure on a school, which is, where our program, RIZE, comes in. We want to work hand in hand with a school to help them. But when they meet us, when they see us, they see that our approach is very different. They're like, this is too good to be true. And I'm like, no, it's not too good to be true. We want to work hand in hand. We're not interested in criticizing you. We're not interested in taking your place in the community. And we're not interested in what you can give us. We're
Right.
interested in what we can give you, to support your kids being academically engaged, reaching those academic benchmarks, which are huge pressure on you as a school, and also trying to re engage parents into being that active, protective part of their children's lives, instead of dropping them off at school and thinking that, here you go, that's where you're going to get your parenting. And that's not fair. It's on schools at all.
Right. No, it's so true. And I mean, that's such a good segue into thinking about the importance of partnership, right? So I have a
Yes.
whole other series in the earlier portions of this podcast about the power in partnership. And that's very much a backbone of community engagement. Well, at least it should be. And I think what you're talking about sets that up very well, just thinking about, You're there to partner. You're there to collaborate. You're there to work alongside. You're not there to take away any efforts, expose anyone's pitfalls and faults, nor trying to leave the parents hanging and saying, well, hey, maybe if you've had a difficult time being able to kind of re-engage your child over this issue, or maybe it's an
Hmm.
issue that has gone on for a long amount of time and you're like, what can I do about it? It's really about that partnership with the student, partnership with the parent, partnership with the school, and obviously any other organization that can come alongside that to be able to effectively create that care that can meet people where they are. So, I mean, it's so important. And I think that's a conversation that has to continually happen, because, we've come to a point, I think, in our society where we recognize we cannot operate in silos. We can't continue to be in our particular umbrella. And obviously, there's a lot of different factors that have influenced that. Funding has been a factor. Is it a duplication of efforts that's been a factor? How do we incorporate this in a manner that will, the data that comes with it? But how can you put all those pieces together and demonstrate that, one part may be something, but as a whole, it's a whole other entity that can do a lot more. So I don't know what partnership has been for you guys. I'm sure it's been great just from hearing what you've said so far, but what does partnership look like for your organization, either for how you serve others or how people can kind of engage with what you're doing?
So that is a really, really great question. And I also want to, before I answer that question, I want to talk about a very good point that you just made about the operation in silos. Not only do we have a huge challenge to overcome with operating in silos, but we have a huge challenge to overcome that people consider these sort of invitations to partner as threats to their existence, their little
Mm,
thing that they're doing. They're
mm-hmm,
afraid that if somebody comes in and wants to partner, that all of a sudden it's going to take away from their
mm,
impact, take away from their piece of the pie, take away from what they're doing. And there are some, and I'm just going to call it out right now, there are some people who have been working in our communities doing certain work for decades that have not been able to create the improvement that they're
mm,
supposed to be creating. And to have someone come in that wants to be involved in that is not conducive to them staying in their comfort zone, which is no one coming in to possibly bring in something better or
mm,
to bring in a different solution. So I think that is one of the biggest challenges that we've had to face because, as you said, we're very passionate about what we do. um, we're also very good at what we do, and we connect differently. We have a very, talking about it with my team today, we have a very unique energy
mm,
that we bring, a unique way to connect. We're not clinical. We are very much relational,
mm,
but
mm-hmm,
built on things that are evidence based. No doubt about it. I respect science. I respect, what is learned in the clinical setting, no doubt. But we have a very unique approach to building relationships with people to where our message, though it may be the same in technical content to what other people are delivering, it is received differently.
right.
So, we do have a niche in that. But what I would love to see happen is that instead of people getting threatened, what they do is they say, okay, we're really good at this thing. They're really good at this thing. Let's work together to make both of our programs very viable and very necessary because we prove that working together brings forth the result.
Mm-hmm,
That
mm-hmm,
should be the approach. We are stronger together. I know that it's a cliche statement, but it is so true. And what we're finding is that the partnerships that we form, they are multifaceted, multi-level. So we form very strong partnerships with administration, school staff, including counselors and teachers. That's really big for us. They have to love us and love what we do and also see the result in their students.
right.
So that partnership there is so critical because we're all on the same page. We're all speaking the same language. We don't have administrators thinking that we're bringing our program in there and usurping what they already have going on. Nope, it's not what it is. We're there to complement and further enhance
Right.
what's already going on. That support structure for the kids. Parents are another huge partnership for us. We have to work very hard to explain to parents that they can trust us.
Hmm.
We are not there to usurp your role as a parent. In fact, we want to strengthen your role as a parent because we advocate for your authority with your children.
Right.
And a lot of times, parents, in this day and age, they are very, very threatened. They feel like their, leadership is being taken. And in some cases, it has been. Their, I guess, status of authority in their family has been overrun by some people in community led programs. Um, so we really find that it's very, very important for us to make the bond with the parents first. We don't give the program to the kids till the parents know who we are.
Yeah.
So that has been a huge thing. It's a respect
Yeah.
factor for them. And then our other sort of partnerships are with nonprofit providers of treatment, whether that's behavioral health, mental health, life coaching, mentorship, skill building, those kind of services. We build partnerships with companies and businesses who know that the success of our program is also going to contribute to the preservation of their future workforce. We also, partner on the federal level with agencies who have a vested interest in the success of our program because they really need for us to be successful. When it comes to law enforcement, they need relief. They need us to help stop the demand for drugs because it is
Hmm.
tearing up our society. The medical industry needs us too because they can't handle it. You've got the Department of Education who we partner with, who needs us, needs our program to be successful so that we can be a viable solution for schools. And then we also have the legislature, representatives and senators in our state who really care about what we do and who are our partners in that they help to provide some funding for us because we provide our program free to public schools. And at the end of the day, every single representative, no matter what political party they represent, all of them are there because they care about the state and they care about the health and the future of South Carolina. So I hope I answered your question well, to kind of give you a full kind of 30,000 foot view.
Yeah, definitely. And I think that's such a good look at how you can take it from the micro, the meso, and the macro level, right? That's a lot
Right,
of what
right,
community health conversations come with. You have to start inward and then build yourself outward. And I think
right.
that's been the major shift when we think about how funding is distributed in the community
Hmm.
health setting, how funding is distributed in health in general, where can you take those grassroots partnerships first and then build from a strong foundation of those who you are delivering the care to, the program to, the activity to, and then having that elevate things that happen on the policy level, things that happen in a systems
Hmm.
level, all of those pieces that come with it. And I think it's such a great refresher and a refreshing thought, I guess I should say, just thinking about the importance of the parents have to appreciate this first. The parents have to feel respected
Right.
first. And
Yep.
unfortunately, there's a lot of things that can happen in school settings that parents may not agree with what's being delivered or how it's being delivered or programs that kids might be
Right.
involved in the community. But you have to involve those parents first so that, as mentioned, they feel like they have some type of partnership. They don't feel as if
Mm,
someone's just coming in and, taking over how my child is raised. And even if someone
yep.
doesn't have all the tools and the resources they need, it does not mean they do not want the best for their child. And I think it's the same
Correct.
way in the healthcare setting, it's the same way in the education system. People just want to feel supported for what they are providing, but also feel
Mm-hmm.
respected in terms of what they can do, what's realistic and what they can do. So I think it provides a healthy outlook on partnership in itself. Because again, as you mentioned, partnership is not here I am to save the day and take over everything. It's here I am with my component, here you are with your component. How can we literally come together with our two components and create something or make something or shift something or move something that is ultimately going to be better for the person receiving it so that they feel empowered to live their best life. And as I
Yeah.
like to say, so they can feel empowered to dare to be influentially visionary. That's the biggest piece of impacting your sphere of influence. So,
Yes.
I mean, with that,
Yes.
obviously, you've mentioned a lot of the needs that come from other folks that, the program that you provide, people need that program in place. What are some of the biggest
Mm-hmm.
needs that you feel like those you serve need, or even for your organization itself? And what are some ways that, even, for example, if there's other nurses, other educators, other professionals that want to help provide innovative solutions, where do you feel like those gaps are currently to get you to kind of stabilize and be a viable source for the long run in the systems and the schools and the spheres that need to receive this type of program and movement that you have?
That is such a great question. I mean, you probably saw my eyes and my kind of my eyes squinting and my forehead wrinkling because I'm trying to figure out how to best answer your question because that is such a deep question, and a really great one. So I think the answer is for for them to really understand what we do,
Mm,
what we're very good at, and how us being able to be really good and continue being really good at what we do is going to benefit them as partners. So many people don't understand that we are not a treatment provider. We are not there to intervene and provide therapy and all of that and be the end all be all solution that is going to replace everything, you know, um, for a child that runs into drug use and needs help or whatever. They people need to understand what our program is built on. So I made a signature methodology over the past 5 years that I've been studying this, doing the program, putting into place the RIZE program, thinking about it being from an evidence-based place, but also what makes us unique. So, and what I thought was missing in the whole thing. So our program is built on a methodology that I've termed breakthrough follow through.
mm,
So we have tons of great follow through support resources. Let's just take Greenville County as an example. Tons of stuff. We've got people that care. We've got people that want to invest in people, that want to help, that provide wonderful help. But one thing that I see over and over is, and that I hear over and over is, we've got the services, but people aren't coming to us.
mm-hmm.
All right. So I said, well, of course not, because they haven't been compelled to do so. Whether that is understanding that they need the help, whether it is trusting people enough to reach out for help and have that conversation, whether it is getting somebody to help them realize and have self actualization, right, about the issues that they're facing. So they'll be motivated to go get the resources. If we do not have the breakthrough, which is caused by good relationships and trust, you
Mm-hmm.
are going to have people at these follow through services, no matter how wonderful they are, be sitting there waiting for the phone to ring.
Hmm.
And what good is that? Because they've got to prove that they are serving a community that needs them. Well, need is only proven through action, right? And through going to get services. So for me, it's the proper communication of help us be good at what we're doing so that you can serve more people because they want to be served by you.
Right.
And so channeling that and really being able to get people to go get the services they need, that's what we how we need to be looked at as RISE prevention, to be the motivator of that. The other thing that I would say is that we hear all the time from kids, from parents, that they do not have hope.
Hmm.
They don't have hope.
Hmm.
And people who don't hope are not people who invest in the present for the return in the future. They don't. They don't protect themselves in the present for a future return. They are living from one day to the next, simply surviving.
Hmm.
And so when they live like that, their choices reflect that. Their choices are more risky, more destructive, less logical, right? And it's not because they're bad people, it's they're people that are operating with a deficiency of hope. And so they don't, these kids that we talk to, they don't care about their future.
Hmm.
Here you come with a drug prevention message that's you need to care about your future, you need to care about your health. They don't care about their present.
Hmm.
They really don't care about their health right now. What we need to do is go doing what RIZE prevention is doing and getting down to the root of why do they not have hope?
Hmm.
The root of why they're suffering, the root of why they don't have any self-worth, the root of why they are destructively self-medicating. And I think that is where a lot of nurses can come in, and especially pediatric nurses that are seeing these adolescents. What they really need is love. What they really need is validation, relationships that they may not have in their homes. They may not be getting positive peer support. And really coming to somebody with care as a clinician, because you are in a unique environment with a relationship with that person where you can get very personal with them, take the opportunity to find out who the person is.
Hmm.
And when you
Hmm.
find that out, then you're going to know better how to address the problem.
Absolutely. Absolutely. I mean, all the way through, if I had the applause effect, I'd put the applause effect on. And
Thank you.
I mean, that's a huge thing in general for any way we approach society, any way we approach
Right.
any sector. Obviously, it's much more tender when it comes to the children, when it comes to youth, when it comes to a lot of the broken things that we're seeing right now societally. At the end of the day, in anything that you do, in being a visionary leader, in anything that's being portrayed, it's the underlying tone is that love relationship, that ability to support someone to get to their next level of who they are in life, and just recognizing that their life matters. Plain and simple. Their
Yes.
life matters. Their life matters. That should be the essence of anything that we do and all the passions that we pursue and all the things that we strive for. That's truly kind of that big mark of leadership, and that's that big mark of a lot of what we stand for, even in kind of this podcast and the Visionary Nurse platform and philosophy. So
Love it.
thank you,
Love it.
Martine. I love it. Thank you for sharing your passion. Thank you for sharing your insight. Thank you for sharing your energy. And also, thank you for the work that you're doing. I know a lot of times for those who are in these ground work, grassroots kind of pioneer roles, oftentimes, not that you're looking for the validation yourself, but just to know, hey, what you're doing matters and it's great and it's beautiful, whether everyone gets it or not, whether it sometimes feels misunderstood or not. Thank you for the work that you're doing to be a support for the families, for the teens, for the communities, so that we can partner together better, so that we can be healthier in the way that we do things. So it's been an honor to have you share your passion and just what you've been doing, your vision. I don't know if there's any kind of last words or things you'd want to promote or ways people can get in contact with you. We'll definitely kind of tag some links in the show notes. And when we get
Sure.
the word out there for the podcast, we'll be able to kind of link people into what you're doing. But I don't know if there's any kind of last minute pieces of the puzzle that you want to share.
Yeah, I just wanted to share just two things for nurses who are listening to this, anybody in the healthcare field. They're not just patients.
Mm-hmm.
They're human beings that are in need and they need you. They
Mm-hmm.
need whatever they're coming into your office for, but they also need to know that they matter. I believe that. And I think that nurses have a unique ability and an opportunity to do that. So I would encourage that. And then also, I would say there's something that I always include in my presentations, which is we do not have a drug problem in this country. There's no problem getting drugs wherever you go. You can even order them on off the internet and get them sent to your mailbox. What we have is a heart problem. that's being medicated by drugs and other addictive behaviors and destructive behaviors. So just want to leave that little thought with y'all. Please do visit our website for more information, RIZE Prevention, spelled RIZE, rizeprevention.org, and rizemovement.org, which is our advocacy arm of what we do. I'm sure you're going to love what we have there and what we're communicating on those websites. Feel free to reach out to us anytime. If you got a nursing group that would love to have us come and talk to you, we'd be more than happy to do that. And just want to thank all the nurses out there for the hard work that you do. I couldn't do your job, and I just really appreciate you, appreciate the sacrifices that you make, the time that it took you to get that education, for you to be out there working. And I know that you take a lot of work home with you. So I just want to say thank you so much for the sacrifice that you make. I'm sure, like me, you consider it a privilege to serve. So let us be thankful every day that we get to be in professions where we serve and can pour goodness and wonderful things into people who we encounter.
Wonderful. Great wrap up. Thank you, Martine. Again, that's Martine Helou-Allen of RIZE Prevention. So exciting to have shared this episode with her and just getting a chance to hear about just the purpose and passion that has lit her fire to allow her to dare to be influentially visionary in the sphere that she's impacting, and for each of you to be able to do the same. So I thank you all for tuning in for another episode of the Visionary Nurse Podcast, where, again, my name is Antoinette Montalvo. I am your host, and it's just designed to educate, uplift, and support each other as we dare to be influentially visionary. Thank you so much for tuning in. Stay well, be visionary, and we'll talk to you soon. Bye-bye.